and I'm here with Tobias Siegel from PromoLife. Tobias, thanks so much for being here with us.
Hey, thank you so much for having me today, and I really appreciate the opportunity to discuss what ozone is and how it works.
Yeah, so I met you and your team in Miami.
Okay,
Um,
yeah,
yeah, and got my first ozone machine from PromoLife, and it's been life altering for me and my patients. I love it. I wanted to do a deep dive into what ozone is, how it can help people, and how it can help our nurses increase a revenue stream in their business, no matter what business that is.
okay.
Yeah, wanted to, let's start with that. Maybe start with, your company, and then we can talk about what ozone is.
Absolutely. So, appreciate the introduction. My name is Tobias Siegel. I am the CEO of PromoLife. Uh, I do a lot of the R&D development as well. Also run a lot of the day-to-day, so I get to work with a lot of the doctors. I get to really go to a lot of conferences, so I get to learn more. So I get to see really what's progressing out there and understand ways to even make it better and create improvements. So ozone in general has been around for a very long time. And really what it is, it's basically all it is oxygen. So you have two parts oxygen, and what you're doing is you're feeding it into a machine, and we're adding an electrical charge to the oxygen. When we do that, we are splitting apart the molecule. So we're basically removing a singlet oxygen molecule that's incredibly unstable, and it wants to reattach itself to the O2, and that's creating ozone. So we're creating a compound called O3, which is what we're going to be using for medical use. It's what we're going to be using for a lot of different applications. Ozone is a very powerful oxidizing agent, and it can be used in a lot of different ways. It's used currently um, in the water purification industry. It's used in a lot of different cleaning and cleaning industries where we're having to deal with like bacteria. But the cool thing with ozone on the medical side is we're using it in a very prescribed dose and a very safe amount, and it's very controlled. And we're also generating the ozone with an incredibly pure oxygen source, which makes it more potent and even more effective. Um, for people who are, hearing about ozone and they feel that it may be viewed as like a negative or a toxic gas, that's very incorrect. Ozone is an irritant when it's in high enough concentration, and it's not. I don't consider it a toxic gas. It is considered an irritant, and really the whole point about ozone in medicine is we're using controlled doses. We're essentially what we're doing is we're taking a small amount of ozone and we're creating a very mild form of oxidative stress on the body. And when we do that, our body has the ability to essentially recharge itself, rebuild itself more effectively because it's being put under like a very mild form of stress. And there's a lot of other components that happen with ozone that make it even more effective. But that's really ozone in a nutshell, as far as like how it's produced, where it's used. Like a good example I like to use for people, if people are concerned about the safety or the toxicity of ozone, is if you drink bottled water, every single bottled water is purified with ozone gas. So it just goes to show you that it is very widely used. Ozone is very widely used, and also what's cool with ozone is it has a very short half-life. Half-life meaning the length of time that is going to be around. So ozone itself has about a 20-minute half-life. So every 20 minutes, the concentration of ozone is cut in half. So if we push ozone out into the room or push ozone into the body, it doesn't last for very long. It does its thing and then it goes away. So that's really ozone in a nutshell. We can start diving into more applications, based upon the questions that Katie asks.
Yeah, so I mean, one of the questions that I just wanted to ask and clarify was because you said it's an oxidizing agent, and we always think of oxidative stress as bad. So, how does that make ozone therapeutic?
So when we apply a little bit of ozone to the body, yes, it does create a very mild form of oxidative stress. but our cells have antioxidant coatings that protects our body from a lot of those stressors. Also, when you add ozone to the body, your liver generates glutathione, so it balances itself out. When you're dealing with it helps your body generate more antioxidants to combat that mild form of oxidative stress. And one component that I really like to stress, a lot of people are utilizing ozone to treat other types of conditions that are more on the lines of like bacterial or viral conditions. And what ozone's doing is, we'll just back up for a second. So what we're going to be doing is we need free radicals or oxidants to fight off that bacteria or virus. And so without oxidation, like if you look at our white blood cells, our white blood cells naturally produce a little bit of ozone to fight off infections. And so we already use the process of oxidation to fight off these foreign invaders that are giving us issues. So without the use of oxidation, we would essentially not be here today. It's really how our body fights off infections. So really what we're doing with ozone is we're supplementing our body with a little bit of oxidant that's going to help overcome some of these other foreign invaders that are giving us issues. So and I kind of want to break that down a little bit more because it's a really cool modality when it comes to fighting off bacteria and infections. So ozone goes after the cell wall of the bacteria. And in doing so, there can never be any resistance built up or antibiotic resistance built up against ozone. What ozone's doing to viruses is it's deactivating viruses. So viruses pretty much carry a positive charge. Ozone's a negative charge. The positive and the negative attract. And so the ozone will essentially seek out and attract itself to these positively charged viruses and deactivate them. That's why we saw ozone gain such popularity over the past 5 years, because there were so many different viruses out there that were giving people issues, and people were being treated with ozone to help overcome a lot of these other conditions out there. When it comes to bacteria, we also have positive and negatively charged bacteria. Most of the bacteria that gives us an issue is going to carry a positive charge. Ozone has the ability to selectively attract itself to that and to essentially seek out and destroy. Ozone is going to be incredibly safe for the body as well, because our cells do have that antioxidant coating built in to protect ourselves from oxidation. So just because we're putting our body under a mild form of oxidation doesn't necessarily mean that's a bad thing, but it's great for when we're dealing with foreign invaders, so our body can help fight those off more effectively.
Yeah, I love that. It was funny because I was on vacation with my family, and it became a running joke because every time somebody said something like, I have a headache, I have my sinuses, my muscles hurt, I'm like, you know what, ozone could fix that. And it became this like thing where, I actually started doing some recordings on that. Is just like, if you have sinusitis, here's how ozone can fix that, basically. So how is it that this can do so many things? And maybe we can talk about the applications of what ozone can do.
Yeah, absolutely. So that's a really good question. So what's really happening is it's generating a healing response with our body. So that term does get floated around quite a bit. Ozone can fix that. So I really like to use the example of injecting ozone gas. So there's a few different therapies out there. The one that I like to see done is called prolozone therapies, where we're taking a little bit of ozone gas, we're injecting it into a joint. We are following it up with, what we're doing first is we're injecting the joint with some dextrose and B vitamins and a few other things. And then we're following it with ozone gas. And so what's happening is the dextrose or the sugar is creating an irritating factor with that joint. And then we're following it with ozone gas, which is then reducing the inflammation and generating that healing response. And so we're seeing a lot of positive results with these types of injections. Like a good example is my wife had an 8 mil herniated disc in her L4. We did an ozone injection in the muscles around the L4, and within about 3 days, that 8 mil herniated disc had almost gone back to normal. And so what happened was it reduced the inflammation and it generated that healing response, which really fixed her situation. You're seeing a lot of, in addition to a lot of these like joint injections, you're seeing a lot of medical practitioners and even dental offices utilizing ozone gas injections with PRP or PRF. So PRP is the platelet-rich plasma. PRF is platelet-rich fibrin, very similar. And so what they found is when you add ozone gas either before or after the PRP or PRF injection, you're finding that it actually enhances the outcome of the PRF or the growth hormones from assisting and healing that part of the body. So ozone generates a healing response, reduces inflammation, and it really helps amplify the healing response of the body. And let's just remember what ozone is. Ozone is all it is oxygen. It's electrically charged oxygen. So I view it as more as energy. We're putting energy into the body, and our body knows what to do with it because it does produce ozone already. It's how we essentially fight off foreign invaders. It's how we heal. And so we're essentially giving our body something that it already knows what to do with, and we're letting it do its thing. And, the outcomes are pretty obvious. We're seeing, countless people who have had benefits when using ozone in various different ways.
Yeah, and I mean it's amazing because I went to a review course recently, and it's we were talking about all the different disease states, by systems, and it seemed like the answer to everything was like NSAIDs, antibiotics, and steroids. And
Yeah.
the question was like, why not ozone? Why is ozone not a mainstream therapy?
Well, there's one quick reason, or there's one main reason. Ozone has been around for over 100 years. It's been in use medically for over 100 years. It's not patentable. There's very little revenue generated from a machine production side. So, like if you're making a piece of equipment to make ozone gas, ozone's not patentable. So it's not really a way for a big, massive company to generate a ton of revenue. Now, from the user side, such as nurses and doctors, that's a completely different story. The huge advantage with ozone gas on a practice side is once you have a machine and you have oxygen, you can generate virtually endless amounts of ozone on demand whenever you feel like it. So once you have equipment, the continuous cost is pretty low. Based upon the treatment that you're providing to the patient. But overall, ozone is one of those things that's been around for a long time. I would almost refer to it as like a generic drug where, you don't see a lot of revenue being generated from big drug companies with generic drugs. You see them, the revenue generated from the new drugs that they come out with. So think about it like that. There's just not a lot of like money in it when it comes to mainstream medicine.
Yeah, and it makes it even more confusing because the FDA will label it as a toxic gas with no medical indication whatsoever, and then you start offering it. It's there's that kind of uneasiness, but it's so good that people absolutely love it.
Well, and let me make a point on that. You are 100% correct, but there's about 20 or 30 other countries around the world that actually have medically approved ozone gas for use. And so they've gone through like the similar to the FDA, they've gone through their organizations and they have actually approved ozone gas for treatments. We're seeing this on the medical side, and we're also seeing this on the dental side. So in the United States, we have the FDA for the FDA for people for like medicines, and then we have the ADA, the American Dental Association for dentists. And so ozone has been approved in other countries for use in dentistry. We're seeing a lot of biological and wellness dentists add ozone to their practice. And the big takeaway that I find is when they start incorporating that into their practice, the amount of antibiotics that they have to prescribe drops dramatically. And so, same goes with on the medical side. You're utilizing a very powerful oxidative tool that can help fight off foreign invaders and infections. And really what you're seeing is less antibiotics being prescribed. Like I just did a summit not too long ago, and our whole focus was on ozone, the use of ozone with menopause. And so
Oh wow.
one of the big takeaways with menopause was during that time, women are more susceptible to infections. And so if we can utilize ozone gas, whether it's vaginal insufflations or even ozone suppositories, If we can reduce the amount of vaginal infections that patient has, we've just lowered the amount of antibiotics that patient has to intake. And so we know that continuous use of antibiotics really wreaks havoc on the gut and leads to other poor health issues. So if we can utilize ozone gas in a positive way and ozone suppositories, if we can, even if we can cut the amount of infections in half, I feel like we've done a pretty good service to a lot of different people out there.
Yeah, absolutely. I love the vaginal insufflation. I've used that quite a few times, and even I'm still getting like, did that really happen? Because I had this one patient that came in and she had HPV that was confirmed. We did vaginal insufflation, and her next test was it was negative. Like she didn't have it anymore, and we're like, was that the ozone? Like nothing else. She didn't do anything else, and so we had to it's like all those things that I know it can do that, but at the same time, it's like another thing to actually see it
Yeah.
and know that it's real.
I'll give a pretty good example. Like I've worked with a lot of individuals, on the vaginal sulfation side. So a lot of women, and this could be more like lifestyle, diet related issues. A lot of like women have had like a lot of endometriosis issues, a lot of heavy periods. And what we find when we start seeing women doing vaginal sulfation, it doesn't take very many. It may take like 2 or 3 before the start of their next period. And we almost see it, everything start to regulate more. So we see, normalized flow, less cramping, less clotting. And so that's a pretty big indicator that we see ozone working at a very fast level. To me, I think that's a huge game changer for a lot of women out there when it comes to, utilizing vaginal sulfation for a lot of these other, conditions such as like period related pains and so forth.
Right. And it's one of those things too that it's so easy to do. It almost, almost feel kind of like it's kind of a weird thing. Like it shouldn't be this easy, but it is. So that's really nice.
Yeah, it is easy. And I mean, it does take commitment. It's one of those things where once you have the tool, you essentially have everything you need. Really all that's really required to generate ozone is your oxygen source. And so, medically speaking, we really want to use a pure oxygen source. And so we use medical oxygen, which is considered 99% pure oxygen. And we use that for a reason. So anytime we use pure oxygen, we've eliminated any other potential contaminant that could be produced or could flow into the ozone machine. A lot of ozone machines out there utilize ambient oxygen, which is 21% oxygen and 76% nitrogen, and then 3% other gases. The issue with nitrogen when it starts to enter an ozone machine, it creates other compounds like nitric acid, nitric oxides, certain unfavorable compounds that are not going to be beneficial for human consumption. And so in addition, there's other pollutants in the air that could get converted. So that's why we really want to use 99% pure oxygen, because we know the end result is going to be that pure ozone that's going to be beneficial for the body.
Okay. Well, let's talk about the machine for a minute because that's really important. And there's lots of machines out there, and there's some cheap machines. And can you talk about what's important to know about the machine that you purchase?
Absolutely. So there's a few different components that we really strive to have on equipment. So first of all, you want to have the first thing is you want to make sure that the ozone machine can take a pure feed of oxygen. A lot of machines out there utilize internal pumps to push air from the outside through it to generate the ozone. You want to have an actual gas feed machine that has an entire enclosed system on the inside, and that's gonna allow us to produce pure ozone. In addition, you want to have ozone resistant components such as highly resistant ozone component transfer tubing, because what happens is ozone is an oxidant, and so it does oxidize other materials. And so a lot of machines out there utilize low end transfer materials such as like certain types of plastics, and over time it starts to break down. You also get contaminants in the ozone when that happens, and that's something that we don't want. So you want to make sure the machine is made with A+ rated components. It has a pure oxygen feed. And then also it's really important to have adjustability on the ozone concentration. So a lot of machines out there are fixed as far as what it's going to produce. And to me, that's problematic because we really want to start out with low concentrations of ozone. We want to let the body adapt to it. And then we may want to adjust that concentration up or downward based upon the patient's need. If we're fixed at a very specific ozone concentration, a lot of times we're going to be too strong. It's going to cause irritation, and we're not going to be doing any benefit for the customer, because if they have a bad experience, they're probably not going to come back. So we really want to start out the patient at a manageable level, and that really helps by having adjustable ozone concentration on the machine. And then second of all, you have to have the right connection types on machines. You want the machine to be able to take a syringe, a Lore lock fitting. You want it to be adaptable so it's easy to use for the components that you guys have in your office. We have different types of machines that have all that stuff built into it. We also have automated systems that are designed to fill syringes from the push of a button. Those are really nice because they can really simplify the usage in the office. Really, our goal when we produce machines is to make it in a way that's usable for a clinic, create high quality components that go into the machine, and also have a lifetime warranty. So by us having a lifetime warranty, it means that we back the equipment, that if something happens to it, we'll fix it. And it also tells us that, hey, we have confidence in our machines that it's not going to break down. A lot of machines on the market, they might have like a 30-day warranty, a 1-year warranty. And I can guarantee you with those types of machines, you're going to have something break down pretty soon. Ozone is highly corrosive when it comes to certain materials. And so it's just a matter of time with those types of machines. So having confidence, peace of mind. We also have a repair center if anything happens in the United States. So we do all the assembling and the repairing in-house, and we do all the calibration. And that's another thing I forgot to mention. What's really important with machines are making sure that the ozone concentration is accurate. There's so many machines out there. They say they produce this, and when you actually test it, it's wildly off and inconsistent. So having an actual concentration that's tested before shipping and provided to you, it gives you more reassurance that you're getting the concentration needed to have a good machine that you can provide ozone to your patients. Like a good example is we look at ozone as we call concentration like either gamma or micrograms per milliliter. And what that means is we're looking at the amount of particles of ozone in the air. And so we know that there's specific concentrations are better for certain things and other concentrations are better for other things. So like if we're doing like an ozone injection, we might want to be around the 10 to 20 concentration mark. If we're doing like an insufflation, we're going to want to be on the 20 to 40 mark. So we want to have the ability to create a range, but we also want that range to be accurate, because if it's not accurate, we're not going to provide the best outcome for the patient. So there's a lot of things to look for in a machine, and really what we stress more than anything is find a reliable company, somebody who has servicing that's in the United States, so you can have the confidence to use your equipment properly.
Yep. All right. So, and let's talk about some of those components, because there's, when I go to Promo Life, I feel like a kid in a candy store because there's so many fun things that you could buy. You have the ear, the stethoscope looking thing that's for ear insufflation. Can you go over some of the things that you guys have?
Absolutely. So, providing ozone to your patients, does require accessories. So there's a few different ways to apply ozone topically to your patients. You can apply ozone. We call this ear insufflation. It's where we're going to put a little bit of ozone gas in the ear, and we're going to use a device called an ear scope that hooks right up to the machine. It's basically what it is. It looks like a modified stethoscope that allows you to push a very small amount of ozone gas into the ears. This treatment takes about 5 minutes. Another thing that we like to do that's probably one of my most favorite treatments. We call it sinus insufflations. What we're doing is we're filling up a syringe with ozone gas, a very small amount, and we're shooting it up the sinus passages while we're holding our breath. So what we want to happen is we want that ozone gas to permeate up there for a short period of time, and then we want to exhale and release any of that excess gas so we're not going to breathe it. And what that's doing is that's literally reducing viral load, because a lot of the viral issues that we come in contact with start replicating in the sinus passages. So if we can reduce viral load, we've just lessened the chance of ourselves getting sick. The other option is topical cupping. So we have cups where you can topically apply ozone gas to specific parts of the body, whether if you have like a cut, a wound, a fungal issue, you can topically apply ozone gas there. And, ozone eliminates fungal issues. It's phenomenal with that. We also have limb bags that you can bag like a hand, a foot. So if you have patients who have like feet fungus, toenail fungus, it's a great way to treat that part of the body with ozone gas. We also have these devices called insulflation bags. And what this basically is, it's a bag that we fill up with ozone gas. So think about it like an enema. Okay, it looks like an enema bag, but instead of using liquid, we're utilizing ozone gas instead. So we call that process rectal insulflation. So that's the process of adding ozone gas rectally. So instead of a liquid, we're adding a gas, and the benefit with that is we're allowing that ozone gas to essentially get soaked up by all the blood vessels in our colon and get transferred throughout the whole body. So that's a very quick systemic treatment for a lot of people who are looking to do ozone, whether it's not through an IV or intravenous. It's a very quick way to do that. Other ways are inhalation. So we can bubble ozone through olive oil, and then we can actually breathe the ozonides and the terpenes that are coming off that olive oil. And that's great results for respiratory issues and other stuff like that. We have a number of other options out there, whether it's like other types of topical applications. And then we also have the IV systems as well. One of the popular IV treatments that we offer is ozonated saline. So that gets we add ozone gas to saline, you hook it up to an IV administration kit, and then you set your drip rate, and then that goes to the patient. And so it's another great way to add ozone to the body. So, and there's a few other ways that you can do it, but those are going to be the most effective and the most popular ways out there.
Right. And then there's also things like ozone oils, which you talked about, the ozone supplements, ozone toothpaste. There was a lot of fun things on your site.
Yeah. And that's another cool thing that I want to address as well. Like ozone oils are typically going to be topical. We do sell a lot of ozone suppositories, which would be obviously used rectally or vaginally. We also there's a pretty hot topic right now. It's doing pretty well. It's called ozonated glycerin. And so what's happening is we're generating different compounds with this glycerin when we ozonate it. And the theory is there's more peroxides being generated in the glycerin. And so there's been some pretty good feedback for people utilizing ozonated glycerin. You can topically apply it to the skin. I use it as a nebulizer. So I create a 10% solution and I nebulize it. We're seeing a lot of medical doctors. They're actually generating a 5% solution that's pH balanced, and they're actually using it as an injection or an injectable, and they're having phenomenal results with that. So there's a lot of cool uses with that, and we're going to be coming out with more products pretty soon that are going to be easier to use, for more consumable side, so patients can take it home, take it with them, whenever they want to. So I think the options for ozone is pretty much endless as far as what's out there, and it's just a matter of getting the right product to the right patient.
Yeah, absolutely. Because and that selection piece, also becomes kind of like, well, should I do this or this or this? And there's just so many ways that you can tackle pretty much like literally any disease state. Like I'm having a hard time thinking of things that ozone can't help. Maybe I don't even know. It's just amazing. So, did you want to say something there?
Oh, well, I just was going to mention, like, you are correct. Ozone is, it's just like the great thing with ozone is our body naturally produces a small amount of it. Our body knows what to do with it. It's not a foreign material. And so all we're doing is when we add ozone to the bodies, we're supplementing our body's own ability to deal with outside issues or foreign invaders. And so To me, it's a no-brainer. You're really helping. Like, I almost look at it from the standpoint of a lot of people are into like terrain theory. So you have like germ theory versus terrain theory. I look at it from a standpoint as it's more so balancing your body's terrain, so your body has a better chance to fight off or deal with what it's currently working on. So it's, in my opinion, it's a terrain balancer more than anything.
Well, let's say like in aesthetics or aesthetics, how is it being used, and is it being added to aesthetics treatments that people are doing?
Yes. I don't have as much knowledge on the aesthetic side. I definitely know people that I can, get that information from. But from a like they're doing a lot of like injections like up around here with it. They're usually doing like small sub-Q injections with ozone gas. That's going to be more on the aesthetic side. Also, if we're talking aesthetics, even the PRP or the PRF as well, that's going to be beneficial. Plus, adding that with some ozone is going to even make it, in my opinion, better. But yeah, there's going to be a lot on the aesthetic side. Also, like ozone oils are great for the aesthetics.
Mm-hmm.
We're seeing in conjunction with some of the sub-Q injections over here, you can apply ozonated jojoba oil to kind of help it out. That's a great treatment option from the aesthetic side. And then, not to mention, it's a great thing to send the patient home with and say, apply this to your face. It's a really cool oil that when ozonated, it feels really good. It soaks in and it generates the body's response to generate antioxidants on the skin. And in my opinion, like I've talked to a lot of people and I've seen, good results. It hydrates the skin well, and it really does keep it firmed up, in my opinion. So they notice a good difference. But yeah, on the aesthetic side, it's pretty cool. I think I'd honestly love to learn more on the aesthetic side. One feedback that I had from somebody on the aesthetic side was they were doing sub-Q injections right over here on the upper cheekbone. And one of the things that they noticed was the person had dry eyes, and that ozone gas must have like traveled upward a little bit to the dry eyes, and they essentially their eyes were back to normal for about 3 to 4 months after that
Oh,
after that
wow.
ozone sub-Q injection. So I think it just goes to show you like you can almost accidentally provide even more benefit with ozone.
Yeah, actually, I like to do it in active acne too because it helps clear that up
Oh
really fast.
yeah, yeah. Acne is a great treatment for ozone. Even the ozone oils for that. Not to mention you can treat cold sores, other areas like that with ozone really effectively. So yeah, on the face, it's great in my opinion.
Hmm. So, what about its role in wellness packages? Like, is this something that people can do ozone just for wellness, or is there not a role there?
Well, let's refer to it as maintenance, I guess.
I
So,
mean, yeah.
um, yeah, so absolutely. So, like we're seeing a lot of biohackers getting into ozone. I mean, if anybody follows Gary Brecka, he's doing a form of ozone right now, which is pretty cool. But overall, from a maintenance standpoint, like if you're dealing with like a viral issue or something's going on, that you feel like you may have come in contact with, it's a great way to lower viral load and essentially boost your body's immune system so it fights it off faster. All I can say is like when, if we're working hard every day, cortisol levels go up. If we're not sleeping, we're more susceptible to, viruses and bacteria out there. If we can add a little bit of ozone gas to the body, it energizes our body. It makes us we feel more awake. We have more energy. It's going to give our body a much better chance to fight off any potential foreign invaders. So from a maintenance side, I think it's amazing. Also, like it helps with like this is a really cool maintenance side with ozone. I think a lot of people are using it more for heart related issues as well. So like it helps with elasticity of the vein. It helps with blood flow and circulation. So if you think about it, if we can keep our veins more elastic, we're going to be so much better off when it comes to like coronary artery disease down the road. So there's a lot of maintenance components with ozone. I think the biggest thing is like circulatory and heart issues. I think that's a great maintenance option with ozone. Not to mention, other like circulatory issues, whether it's like on the limbs or somewhere else. There's just a lot of really cool treatments with ozone when it comes to maintenance.
Now, see even more stuff. And I know they're making a documentary movie about ozone. So, as that starts to come out as well, this is going to get more and more attention, which all the more reason to get into ozone like now, because that movie is going to be coming out in the next, I know Netflix and a bunch of different channels were looking at, buying that from the group that's making it. So have you been part of that as well?
Yeah. So they've opted not to go with Netflix,
Okay.
because the problem with Netflix, and we can also look at what happened with that documentary called Root Cause, which was, it kind of talked about root canals. It was up on Netflix for a little bit and then they pulled it. So um, that's the biggest concern when coming out with like a movie on ozone therapy that's showing a lot of positivity is it going to get pulled by a big, like, what's going to happen is Netflix going to be like, it's too risky. We're going to take it off. Netflix, anytime Netflix produces a movie, it's their movie. It's not the producers. They control distribution fully. And so they get to decide where it goes, how long it stays up, when it gets pulled. And so that's very risky in our opinion. So even though they would pay for the entire thing, to me, that's very, very risky. So they've opted to independently fund it. So if anybody listening goes to o3movie.com, there's a place where you can help fund that movie and help make it happen. So I'd recommend everybody go there, just pitch in a couple bucks, whatever you can to help that movie move forward. And then that allows, once that movie is fully completed, it allows for whatever distribution is necessary. So they can't take it down, they can't block it because it's independently produced. It's not funded by a major movie studio.
Right.
But yeah, you can wash your clothes with ozone. There's just countless different things you can do. You can drink ozonated water. So also, like, from a dental health standpoint, swishing with ozone water is going to be probably one of the best mouthwashes you ever try, and you'll love it. It helps reduce plaque buildup throughout the day, keeps your breath fresh, it keeps the infections down, it keeps inflammation down in the mouth. If you apply ozone gas to the teeth and the gums, what it's also doing is it's hardening your enamel on your teeth, and it's also, it's hardening any of that soft tissue that's around your tooth as well. So you're looking at it from a standpoint of increasing oral health. They say 80% of chronic illness starts in the mouth. So maybe it's a good place to start.
How do you do the gas to the teeth? Like, how are they doing that?
There's ways to do it. So, you can apply, like, we have these dental mouthpiece or dental hand pieces where you can actually like apply ozone gas to like between the teeth. It gets a little tricky because you do have to hold your breath while you do it, or, breathe through your nose, because we don't want to breathe in ozone gas. Like I said before, it is an irritant. If you breathe ozone gas, it will make you cough. It's not going to kill you, but it will make you cough. So when a dental office does it, they use a handpiece and they apply the ozone gas, but they have a suction device that sucks that excess gas away. So you're not actually inhaling. So you don't have to worry about inhaling. It's similar to what they're doing when they're cleaning your teeth and they're rinsing your mouth out with water. They're evacuating that water so you don't accidentally inhale it.
Oh my God.
So really cool.
I just ozonating myself. I love it.
Yes.
All right, Tobias. I mean, this has been so amazing and so helpful. I know, like, any nurse that's out there that's even on the fence about this, like, this is just an amazing thing to offer. Even if you just started with oils and sold oils to your patients, you would benefit them enormously. And like you said, with the water too, you can wash your face with ozone water as well, and that helps clear up acne as well.
Yes, it does. Really, it's just it's basically what it is. Ozone is a safe, incredibly safe sterilizing agent that you can literally drink. Like, if you drink ozonated water, it's completely safe. It does not hurt you. It's basically like, if we look at it from a dental standpoint, there are different type of sterilizing agents that they can use in the mouth based upon what they're doing. Ozone's one that they can use wherever they want, and they don't have to worry about it. And so they don't have to worry about, you can inject ozone gas into the vein and your body absorbs that gas and it does not cause any embolisms whatsoever. So there's a lot of really cool ways to use ozone. It's incredibly safe. Obviously, we want to use it properly because it makes it even more safe. But overall, it's a fantastic tool for people to implement, whether it's in their office or even at home.
Okay. And anybody that's interested in getting started with Ozone, how do they find you and where do they go?
What I'd recommend is go to promolife.com. So it's promolife.com.
All right. Awesome. Well, thank you so much for sharing this with us today.
Thanks so much, Katie. I really appreciate the time.
Yeah.